Trachoma, a contagious bacterial infection of the eye, is the leading cause of preventable blindness in the world. Caused by bacterium Chlamydia trachomatis, trachoma is spread through both indirect and direct contact with eye and nose secretions from infected individuals. Therefore, common household objects such as towels and toys can also cause transmission. In addition, eye-seeking flies and other insects are a major vector of transmission for trachoma, especially in developing countries. Known as a quiet disease, trachoma infection typically occurs in childhood, with blindness not occurring until adulthood.
The infection progresses over 5 stages: inflammation follicular, inflammation intense, eyelid scarring, trichiasis, and corneal clouding. Symptoms vary throughout the process and include eye irritation, itching, discharge from the eye, eyelid swelling, pain, and photophobia. Inflammation occurs due to 5 or more follicles appearing on the conjunctive or inner surface of the upper eyelid. This inflammation then spreads to the upper eyelid. With repeated infections, inner eyelid scarring occurs, which can lead to the eyelid becoming distorted or turning in. The deformation of the inner eyelid causes the eyelashes to turn inward and scratch the cornea. This is called trichiasis. Finally, the cornea becomes infected due to the surrounding inflammation. This, in conjunction with trichiasis, leads to the cornea becoming clouded, affecting sight. If secondary infections occur, ulcers can develop, causing partial or complete blindness. In 1997, the World Health Organization, in collaboration with a number of international health actors, announced an official plan to eliminate trachoma by the year 2020. This strategy, known as SAFE, highlights the fundamental causes surrounding trachoma. The S in the SAFE program stands for surgery, which WHO recommends should be utilized to correct the debilitating and blinding scarring. While surgery is a useful strategy, it does not reduce the rate of reoccurrence. Surgery should be taken as a restorative measure in addition to further preventative actions. The A aspect of the SAFE program, antibiotics, is the beginning of the preventative measures that SAFE utilizes. The WHO recommends the use of azithromycin to treat cases of trachoma. The mass treatment of antibiotics has also been proven efficient at reducing the rates of diseases. The F of SAFE highlights facial cleanliness. Major educational programs have been implemented to educate citizens on the importance of maintaining facial hygiene. Daily face washing helps to reduce flies around the face, thus reducing the rates of transmission. Posters, classes, and mass marketing campaigns have been used to increase hygienic practices in endemic areas. Environmental infrastructure, the E of the SAFE strategy. This aspect works to make significant improvements in access to latrines, running water, and disposal of waste. Transmission rates should decrease with improved hygiene and sanitation. The E of the SAFE program has been called the most important aspect of the strategy. By implementing all 4 aspects of the strategy simultaneously, countries have been able to successfully eliminate trachoma, drastically decreasing rates of blindness. Morocco began the SAFE program in 1998 and was able to declare trachoma eliminated by 2006. In addition, Gambia, Ghana, and Vietnam are all on track to reach their goals by utilizing the SAFE strategy.
Trachoma's transnational impacts, challenges with control, and its association with fundamental causes of disease make it a global health issue. This infection affects the eyesight of approximately 2.2 million people each year, 1.2 million of which become irreversibly blind. Challenges to controlling the spread of the disease are the limited supply of antibiotics, high rate of transmission, and close living quarters. Trachoma is closely correlated with poverty and primarily affects those living in impoverished situations. Trachoma is endemic in 53 countries around the world and is most prevalent in sub-Saharan Africa. It is recommended that the SAFE strategy continue to be implemented in trachoma endemic countries with the continued aid of the World Health Organization and other international health actors. Mass distribution of erythromycin should continue to be used and monitored for its efficiency. However, countries should focus on increasing the environmental infrastructure while promoting hygienic practices to eliminate this infectious disease.
The trachoma infection transmits very easily, with infection occurring in childhood and progression advancing with age. It is endemic in 53 countries, and about 8 million people are blind due to this infection worldwide, one of the factors making this infection a global health issue. In summary, while trachoma may not be life-threatening, working towards its eradication is vital. Continuing to utilize the WHO's SAFE strategy should lead to eliminating trachoma by 2020.